The next topic is discuss the importance of care coordination and interdisciplinary/multidisciplinary care. How do we optimize these to the best of our ability going forward, whether this is from a clinician standpoint or also just an organizational standpoint as a whole?
Yeah, maybe I'll jump in first. There are two pieces here. I think you've asked actually two different questions, right? There's how do you organizationally make sure you're coordinating the care that's needed for the complexity of, the follow-up or the treatment plans. And then there's also kind of the role of sort of interdisciplinary and multidisciplinary care, I think. So I'll start maybe with the coordination of care piece. I think when we're talking about, for example, with patients going on these different therapy, whether it's the gene replacement therapy, whether we're talking about intrathecal dosing or even the oral administration, these all require making sure that we have, again, the baseline safety labs, a sense of baseline function, all the testing we need. And then, again, after that discussion and careful considerations with the family and a decision has been made about which treatment, once we're on that pathway, we, at least at our institution, we have, for example, these little roadmaps, sort of depending on which treatment you're on, in terms of, what are the follow-ups necessary to assess safety, for example, especially if you're talking about a gene replacement therapy, for example. What does that look like for safety follow-ups, for lab monitoring, vital sign monitoring, exams, peri-gene therapy, steroid management, et cetera, and the ongoing follow-ups needed to assess both safety as well as efficacy. Similarly, with our other treatments, we have periodic lab monitoring, even for those taking oral therapy, or with intrathecal therapy, there's the loading phase and then maintenance dosing. So these all require really nuanced coordination of care and making sure that your care team, so your sort of neuromuscular team, your care coordinators or nursing coordinators, et cetera, perhaps the area in the hospital where you're going to have the delivery of these therapies, whether it's an infusion space, OR space, radiology space, your pharmacy team, there's really a need for massive communication, regular communication, making sure that care team knows what phase the child or patient is in that treatment cycle. And so this is really, I think, it's been exciting, but also definitely taken work, I think, for all the neuromuscular clinicians with these new therapies to make sure that you really have that level of coordination within your institution, and methods for communication and methods for making sure that that the patients and families are staying, that you stay on schedule with them to make sure that these really important assessments are occurring. So I think that is a really important piece around any site, really, when we're talking about being able to manage and monitor the treatments that these individuals may be on.
Again, this was really excellent point, and I think the magic word is team, and SMA is really a complex disease that requires input from multiple specialties. It's neurologists, it's pulmonologists, it's orthopedics, it's PT, OT, nutrition, mental health, just to name a few. And it is an important care model to go from a reactive to a proactive care model. And this is more likely to help optimize function and mitigate any complications. One of the nice things about the workshop is, in addition to the healthcare providers, we also had the community working group as part of the document. And one of the major points that was also mentioned by Diana is that came from a consensus of the community working group is establishing a dedicated SMA care coordinator. So a point person who could help streamline the process in terms of access to specialists, access to treatment, help troubleshoot all the logistics and the paperwork related to that. The reality is multidisciplinary and interdisciplinary care is not really present everywhere, and so there is geographical limitation as to where you could get that or you could reach that. And so some of the things that could be done is really using telemedicine, try to use remote monitoring to help supporting the care. And also one of the other things that also came from the community working group is this whole thing about the education as well as the psychological support. And so and there are specific items in terms to the education, and Diana went over many of those as we are answering some of those questions. And so it is SMA diagnosis, education, it is the treatment education, it's going over the different mechanism of action, going through the route, sharing the data as we have it. What are the clinical trials that are out there? What's we know from the real world data? What's the efficacy? What's in terms of the safety? What is really out there to get to that point of a shared decision making? Everything has to be more of a holistic approach to the overall care and to provide that. Not only that, also provide support resources that will allow them to get the time with the information. And so I think those are some of the best practices for care teams that came out from the work.